How diabetes affects women. Diabetes is a chronic disease that impairs the body's ability to regulate blood sugar levels. Both men and women can develop diabetes, but some symptoms are more likely to affect women. Many of the risks of diabetes affect both sexes, but there are some differences. Still mostly women. Around 1 in 9 adult women in the United States has diabetes, according to the Centers for Disease Control and Prevention, CDC, oral and vaginal thrush. Women with diabetes are more likely to have yeast infections or thrush in the mouth and vagina. High blood sugar creates an ideal breeding ground for the candida fungus that causes this condition. Symptoms include skin pain, vaginal discharge, itching sensation, dyspnea or painful sex. A white coating on the tongue. If the fungus infects the mouth, people with diabetes are more likely to develop different types of infections, with more severe symptoms and a higher chance of complications than people without diabetes. Urinary tract infections, UTIs. Women with diabetes are at higher risk of urinary tract infections, UTIs. Symptoms of a UTI include painful urination, burning, cloudy urine, and blood in the urine. If these symptoms are not prevented early, it can lead to complications later on, such as kidney infections, sexual dysfunction, higher risk of UTIs or candida infections, which may contribute to decreased sex drive or sex drive. Many with diabetic neuropathy, polycystic ovary syndrome, PCOS. People with diabetes are more likely to have PCOS, a hormonal imbalance that means the ovaries can't release an egg. This may affect fertility. PCOS is not a symptom of diabetes, but a woman with diabetes is more likely to develop it than a person without diabetes. According to the American Diabetes Association, ADA, genetic factors may play a role, but there may also be a link between PCOS and insulin production. Gestational diabetes. Gestational diabetes is a temporary condition that affects some women during pregnancy. Women with pre-pregnancy diabetes need to take certain steps to ensure a safe pregnancy. Blood sugar. If possible, keeping blood sugar under control before pregnancy is very important. High blood sugar can harm an unborn baby and can lead to birth defects. This is especially true in the early stages of pregnancy, when a person may not even know they are pregnant. Effects of gestational diabetes. Gestational diabetes usually goes away after giving birth, but a person who has experienced it may have a higher risk of developing type 2 diabetes later in life. There may be no symptoms during pregnancy, so screening is important, especially for those who may be at risk. If you have gestational diabetes, it's important to follow your doctor's instructions for diet, exercise, and blood sugar monitoring. After pregnancy. When a person develops gestational diabetes during pregnancy, the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, recommends taking the following steps after delivery. Screening for type 2, 6 diabetes -12 weeks postpartum and every 3 years thereafter. Return to a healthy weight through regular exercise and a healthy diet. Breastfeed, if possible, to provide them the right balance of nutrients and help you burn calories. Check with your doctor about using metformin, a medicine, to help prevent type 2 diabetes. Menopause. Menopause and the years leading up to it include many changes that can cause diabetes or make it worse. Hormonal changes change the way cells respond to insulin. Blood sugar levels may become less predictable and require more frequent monitoring. Menopause leads to a drop in estrogen levels because the ovaries stop producing eggs. A person may be more susceptible to UTIs and vaginal infections at this time if they have diabetes. Many women experience weight gain during menopause. Women with diabetes may need to change the dose of insulin or oral diabetes medication to accommodate these changes. However, the authors note that treatment will depend on the individual. Risk factors. Gestational diabetes is more likely if a person is overweight before pregnancy, has prediabetes, when blood sugar is high but not high enough for a diagnosis of diabetes, has a family history, have diabetes, have had gestational diabetes in the past, have PCOS. Diet and lifestyle factors. Diabetes can increase the risk of complications during pregnancy, so a person should work closely with their care team. Their health care to establish a safe diet, an exercise plan, home blood glucose testing schedule, necessity of other testing and monitoring.